Do you have icy cold hands and feet? Have you ever seen your fingers and toes become purple and feel numb in cold weather? Hi everyone, I'm Dr. Selma Lee, a board-certified rheumatologist. Now that Thanksgiving is over and the days grow colder, some people might notice their fingers or toes feeling unusually cold or even turning white, blue, or red. This is called Raynaud phenomenon, a condition that affects blood flow of parts of your body that are far from your body's core, usually fingers and toes. Today, we are diving into what Raynaud phenomenon is, how to prevent it, and the difference between benign form and its more serious counterpart. Raynaud phenomenon occurs when the small blood vessels in your fingers or toes spasm and temporarily limit blood flow. This is usually triggered by cold temperatures. Our body always tries to protect our life or survival. So, when the temperature gets cold, our body tries to keep more blood in the core to protect major organs like the heart and the lungs, even if it means the blood flow of fingers and toes decreases and gets compromised. Raynaud phenomenon occurs when this physiology gets exaggerated. So, naturally, it occurs to the area that are far from the core, such as fingers and toes, and sometimes even ears and nose. Sometimes it can be triggered by emotional stress, where sympathetic tone, which is the part of our nervous system that causes fight or flight response, becomes too high. Raynaud phenomenon typically progresses in 3 phases, but people often can see only 1 or 2 phases too. 1. The affected area turns white as blood flows get restricted. 2. It may turn blue due to the lack of oxygen. And finally 3. It becomes red as blood flow returns, often with a tingling or throbbing sensation. This color changes is one of the hallmarks of Raynaud phenomenon. So how can we prevent this episode? Here are some simple yet effective tips. Dress warmly in layers, especially making sure that your core stays warm. Also, covering your hands and feet with insulated gloves or socks and boots is very important. Avoid holding cold items like icy drink without protection if you are very sensitive to getting Raynaud phenomenon. Even picking up frozen food in a grocery store with bare hands often can trigger Raynaud phenomenon. Manage stress, as emotional triggers can exacerbate symptoms. And if you're a smoker, consider quitting as smoking narrows blood vessels and worsens Raynaud phenomenon. Avoid caffeinated drinks such as coffee or tea, as caffeine can constrict blood vessels. If you are taking a medicine that constricts blood vessels, discuss with your doctor about changing the medicine to something else that does not constrict blood vessels. Now, let's talk about the 2 types of Raynaud phenomenon. Benign or primary Raynaud phenomenon is the most common type of Raynaud phenomenon and occurs on its own without underlying causes. It's often mild and manageable with lifestyle changes, as explained before. Second type, pathological or secondary Raynaud phenomenon, is less common but more serious. It's often linked to underlying conditions like scleroderma, lupus, or peripheral artery disease. In these cases, the episode can be more severe and prolonged restricted blood flow can even cause ulcers or permanent tissue damages in the area that did not get sufficient oxygen and nutrients. If you're experiencing Raynaud phenomenon, it is important to pay attention to the frequency and the severity of the episodes. If you notice persistent symptoms, pain, or signs of ulcers, please discuss this with your doctor. Your doctor will be able to help evaluate whether you have the benign form or if there's underlying condition that needs treatment. Remember, prevention is the key. Keep your body warm, reduce stress, and take care of your vascular health. And if you suspect you might have Raynaud phenomenon, especially the pathologic form, please don't hesitate to seek medical advice. Early diagnosis can make a huge difference. Thanks for joining me today. If you found this video helpful, give me a thumbs up and share it with someone who might get benefit. Don't forget to subscribe for more insights on keeping your body and mind healthy. Stay warm, and I see you in the next video.